My name is Jack Connor. I'm an emergency room nurse here at Plainview Hospital. I've worked here for 14 years. Being a nurse in the emergency room is like the best place to be a nurse because you have a very independent type of practice. You work really closely with the doctors. You always have doctors that you're working with. You don't have to call a doctor. He's right here. And once you get to know the individual doctors that you work with, when it's really, really busy and the doctor hasn't seen the patient yet, you go in, you're the first contact with the patient, you assess the patient, you are the first step in trying to figure out what's wrong with them, why they're here. You already know, having done it many times, what the doctor expects in terms of testing. So you'll, preliminarily start the IV, draw blood, maybe order x-rays, things like that, in contact with the doctor so that things are expedited and the patient doesn't have to wait. When people come into the emergency room, one of the first things that we do is apply oxygen to them. Oxygen is probably one of the resources that we use the most on almost any patient. So we have oxygen at every bedside. It comes from outside. There's a large tank. It's piped underneath the ground up into the building, and then it's piped throughout the walls in the entire building. Actually, some of the best things that I do here is relate with the patients that I take care of in a lot of different ways. Being able to educate them about their health or their disease process, getting that positive feedback. Sometimes, when you feel like you've made a great difference in their lives, there's really, what better feeling can you have than that? Than when you're having that positive impact on somebody. That's something, probably the thing I enjoy most about what I do. One of the coolest things that we had was there was another nurse in triage, and she came overhead and specifically said, "Jack, come to triage right now." And this particular nurse she's like ice. She's very cool. She never gets frazzled. So her coming overhead with that was like someone else screaming. So I kind of ran out to the triage room, and there was a 40-something-year-old guy in triage clutching his chest, and he started going down right in front of both of us. So kind of caught him, threw him on a stretcher, ran him into our trauma room, and I'm sure you've all seen on TV the defibrillators. So I grabbed the defibrillator and I put it on his chest, and there's something called a quick look feature on that tells you the rhythm, and he was not only in cardiac arrest, he was in a rhythm called ventricular fibrillation, which is shockable. So I charged it up, Donna charged it up, and I shocked him, and the guy just sat up wide awake and said, "Was I just dead?" It's very interesting because I've been actually doing emergency medicine since I was 18 years old. I started as an Army medic, then I worked on ambulances as an EMT and an advanced emergency medical technician for a number of years before I decided to work in a hospital. And I've seen, the onset of AIDS. I remember when it didn't exist. So that changed medical practice completely. We didn't used to wear gloves hardly ever. Sterile procedures would be the only time you wore gloves, and now you wear them constantly. Now anytime you go to do a procedure on a patient, you wear gloves. So that's, just all of those things, the technology. I remember when CAT scans, started, when the CAT scan was brand new, when MRIs were brand new. I remember when CAT scans took 40 minutes to do an abdomen. Now they can do it in one breath hold. It's really, really interesting. And then some of the things that we do in medicine now is called best practice. Things that we used to assume were the best way to do things have now been researched, and it's changed medical practice tremendously. So that's some of the things that we've seen grow. So another crazy thing that happened here, it was about 10 degrees, literally 10 degrees outside. And a gentleman came running into the emergency room. "My wife's having a baby, my wife's having a baby." So I didn't put a shirt on or anything. I figured he parked right outside. I go with him outside and I'm like, "Where are you parked?" He was parked just about as far as you could be from the emergency room entrance. I said, "Go get the car, bring it over here." He said, "I can't, she's having the baby." So I ran over to the car with him, and the woman is crowning in the car. It's 10 degrees out. You know, that's like the worst thing that can happen for a newborn is to come out from 98 degrees inside your body to a 10-degree coldness. So I was, you know, very concerned about that. In any event, with nothing, because of but my shirt, I delivered the baby in the car. The dad, in the meantime, ran back and got help. So by the time the help got there, this was her 5th child. So it just kind of squirted right out. And I got the baby, I put it on mom, I took a coat, I put the coat over the baby, and we got her inside, and you know, ultimately everything was okay. So I'm really glad that I've become a nurse. Working in the emergency room is the only thing that I like to do. I feel like I can make a real difference here. You know, I have a level of expertise that I can share with people, and find it as one of the most satisfying jobs that you can do. When you walk out of this building at the end of your shift and you've made a difference in somebody's life, it's a very satisfying feeling.